I was diagnosed with breast cancer at 32 years old. I was 32 years old when I was diagnosed with breast cancer. And I went through the whole series of scans and tests and biopsies. And one of the first things my oncologist recommended is that I get a PET scan to see where the cancer is, if it had spread anywhere else outside of the breast, and as well where in the breast it is and how active it is in the breast. My PET scan revealed a big tumor in my right breast that was very active. I think in the PET scan world they say FDG uptake, and it had a very high level of uptake, which means it was I believe it means it's very aggressive and a very active cancer, which the biopsy proved it to be as well. Shortly after my initial diagnosis, they found additional tumors. I had a metastatic lesion in my spine about 2 years after my original diagnosis, and then about 4 years after my original diagnosis, it was also discovered in my lungs, in which I'm currently in treatment for. So it's sort of ongoing. I was in remission for a little while, and then it came back, remission again, and it came back. PET scans are really crucial. I see they're different than CAT scans. I get them together. And the CAT scan shows the physicians and myself the anatomy of where the tumors are, but the PET scan shows the activity of the tumors. Because it's not enough to know where something is, it's also important to know if what you see in a CAT scan is cancer, and also how active is it, how large is the FDG uptake, because that's also a measure of how treatment is working, not so much if it's shrinking it, that's wonderful, but also if the uptake is decreasing over time, it means that the cancer cells are dying off, or that it's not as active as it was in the past, and that treatment is still having some effect. And I've had that experience in the past, especially with my spine tumor. With the follow-up scans, I get the PET scans every 3 months, and they would initially show a great increase in uptake. And then with treatment, as treatment progressed, the FDG uptake would decrease. And that was great to see. That was really great to see. It's a little tough. There's always the anxiety about not knowing what the outcome will be. But the test itself does not bother me so much. You know, the actual physical preparation for the test. But the anxiety is more of what the outcome and the results would be. And I just sort of try to relax and tell myself whatever will be, and that whatever the outcome, that there is always some solution and some treatment that we can treat with. Well, as a breast cancer advocate, especially being diagnosed so young, I do a lot of outreach towards the younger women diagnosed with breast cancer, as well as women of all ages. And I would like to see less hassle in getting the scans they need covered by insurance, or what's the word? Or being, covered by insurance, or being ordered by physicians. If it's necessary, then to do it without any hassle or delay. Because breast cancer, it's an aggressive cancer. It can kill, and the reason we have such high recovery rates is because we catch it early and treat it early. And with PET scan technology, that helps in that diagnosis. And there's no reason for delay, especially if it's due to issues with insurance. Advancing technologies, I think, are a great thing. They really help in diagnosing cancers earlier, or even if people have recurrences, to find them sooner, or to be more specific in their location, and therefore find a more specific treatment for that person that will give them a longer life and a better quality of life for the years that they have. And so I think advancing technology is wonderful, and if it's the appropriate test for that patient, they should have it covered and have it ordered and have it part of their follow-up plan. The public should definitely be educated about what these technologies do and where they belong in the diagnosis and follow-ups in their treatment plan and their follow-up plan. And to understand what it means. What does a PET scan mean? You know, the letters, that it's not a cat or a dog, it's PET. and in layman's term explain to them what it does and how it differs from the other scans and how it complements all their scans and tests to give them a good idea of what's going on in their body. So it's very important, definitely. It's not so much the more the better, but the more specific and the more thorough the better.